Hello, Miss Brittany. My name is Stacy, and I'm going to be doing your assessment today. We're just going to start with your head and face and neck and do some regional lymph nodes, okay? And then we'll progress to your ears and your eyes and your nose. And is that okay with you today? Okay. Do you have any questions for me before we get started? No? Okay. So what we're going to do is I'm just going to do an overall general assessment right now. So I'm just going to start up here. I'm going to be massaging, checking for any edema, swelling. Do you have any pain or tenderness, Maria? No? Okay. And I'm just checking for some lumps or deformities. Have you ever had any head injuries or anything? No? Okay. And no tenderness, right? Okay, perfect. Now what we're going to do is we're going to move on, and I'm going to check your temporal arteries. What you feel right here, okay? I'm just going to make sure they're equal on both sides. Alright, very good. I'm going to move on down, and I'm going to be checking for TMJ. And I'm going to make sure that when you open your mouth for me real wide, there you go, and close, and do it one more time for me. That's equal on both sides, okay? No pain or discomfort with that, correct? Okay, perfect. Now, we're going to move on to your lymphatics, and I'm going to start here, and you're going to be feeling me do a little circular motion. What I'm doing is I'm checking for those lymph nodes to see if there's any swelling. Now, you let me know if there's any pain or tenderness with those, okay? Now, I'm going to start on your right side here, my right side, your left, right? And I'm going to go underneath of the chin, continue that circular motion all the way. And I don't feel any swelling or anything. Then do the same thing here. Alright. Now I'm going to go back, and I'm going to go down. All the way down to your supraclavicular. Alright, and the nose are right here. I need you to just shrug your shoulders for me. Alright, very good. Very, very good. Now, I'm going to move on, and I'm going to be checking your thyroid. So I'm going to come in behind you. Come in behind you here, and it's going to feel a little bit weird for you. But I'm just going to palpate it from both sides. Can you swallow for me? Alright, very good. Do you have any history of thyroid disease or cancer or anything in your family? No? Okay. Now, you come back to the front. I'm going to take your trachea out, so I need you to tilt your head up just a little bit. I'm just going to do. I don't feel any nodules, any masses, anything like that. Alright. And the last thing I'm going to do is check for your range of motion in your head and neck, okay? So I need you to tilt your chin to your chest all the way down for me. Perfect. And you need you to tilt your ear to your shoulder without moving your shoulder, okay? Perfect. And again, over here. And all the way back for me. Okay, very good. Now, the last thing I'm going to ask you to do is a little bit silliness, okay? But I'm testing the muscles in your face and the nerves in your face. So all I need you to do is smile for me. Beautiful smile. And act sad. Oh, okay. I don't like to see you sad. Alright, now, pretend for me that it's your 21st birthday and you just won the lottery. So I want you to smile as big as you can for me. Cheese. Alright, perfect. And that's just to test that cranial nerve number 7. Make sure you're up all the way, okay? And you're perfect. So this completes our assessment of the face and head and neck and the lymphatics. So we're going to next one, we're going to move on to your ears, okay? Do you have any questions for me? No. All right, perfect. Okay, Miss Brittany, I'm going to start out now, and I'm going to inspect your ears, okay, both outside and the inside of them, okay? Can you go ahead and take your earrings out for me? Perfect. And look straight at me, and make sure they're symmetrical. Yours look good. I'm going to inspect both of them. Make sure that you don't have any lesions, bumps, cysts on any of them. Good. Alright. Do you have any history of ear pain, ringing in the ears, any surgical procedures of ear tubes or anything like that? No? Okay, very good. So this is your auricle and this is your tragus, okay? I'm just going to be pulling on them a little bit. Any tenderness with that? Any tenderness over here? No? In there? Okay, very good. Then I'm going to inspect the inside of your ear and the hiatus and just make sure that there's no swelling, there's no lesions on the inside of your ear, no redness, and no discharge, excessive discharge, okay? Okay. Over here, do the same thing. And I don't see any swelling or discharge or lesions or anything in there, okay? And now what we're going to do is I'm going to inspect the inside of your ear. And you probably know it as the eardrum, and it is actually the tympanic membrane. And like you said, you don't have any history of injury, correct? Okay. And no problems today? No pain or anything? All right, very good. So, you just let me know if you do have any pain or discomfort. And what I'm looking for is to make sure that your eardrum is nice and pearly and gray and shiny, and there's no bulging, no perforation. I do know that you have just a little bit of what we call earwax or cerebrum. Okay. Do you have any pain or anything? No? And there's no redness in there, so that looks great. I'm going to do the same thing on this side, okay? You let me know if there's any pain or discomfort, okay? I'm just going to pull up here just a little bit where I can get a better view of that eardrum. Alright, and it's nice and pearly and gray and shiny. No perforations, no bulging. So that looks great. Alright. Now, we are going to move on to the hearing test. And this is called a whisper test. Okay, so I'm going to push right here. And I'm going to turn my face away from you. And I'm going to whisper, okay, over here in this ear. I'm going to whisper 3 numbers, and I want you to repeat those back to me, okay? Over here. Okay. 4, 5, 6. Okay, very good. I'm going to do the same thing on this side, okay? 7, 9, 3. All right, perfect. You passed, great. Now, the next thing is that we're going to do is we're going to test with a tuning fork. I'm going to hit it, I'm going to place it over here, and then I'm going to place it to the back of your ear, okay? It's bone over air. You tell me which one is greater, okay? So here we go. Alright. Which one was greater on that one? The first one? Okay. Same thing over here. Alright. Right there. The first one? Perfect. Alright. Now, I know that our speech today, that you done very well. Don't act like that you have any hearing problems. Do you hear me okay today? Okay. Well, that completes our hearing test, and the next thing that we're going to move on to is your nose. Okay, do you have any questions for me? No. Okay, perfect. Okay, Miss Brittany, we're going to start out. We're going to do your nose and your mouth and your throat now, okay? So what I'm going to start with, and I'm just going to hold your head up real straight for me, and I'm going to palpate the outside of your nose, and I'm just looking on the outside of it as well for any lesions, bumps, bruising. Do you have any history of any nasal fractures, bleeding, polyps, lesions inside or outside of the nose? No? Okay. Very good. And now we're going to go ahead and I'm going to inspect the inside of your nose, okay? And I'm going to use this nasal speculum and a light. I'm going to shine up there, and I'm just going to check for some polyps or your nasal drainage. Do you have any like discoloration of your drainage right now? No? Okay. Very good. So here we go. I'm just going to insert this here. If you can tilt your head back just a little bit. There we go. I'm going to shine up in there. There we go. I'm just going to check now make sure that there's no polyps or lesions or anything. Perfect. I'm going to do the same thing on this side, okay? And down here just a little bit. And I don't see any lesions or polyps or bleeding or nasal discharge at this time. Okay? Now, what we're going to do is, do you have any trouble with your sinuses? No? Okay. So this is called your frontal sinuses, and I'm just going to be palpating. Okay? palpate there. Do you have any pain or tenderness?
No.
And this is your maxillary sinuses. Same thing. It's going to be any pain or tenderness when I do that? Okay, very good. Now, the next thing I'm going to do is called a translumination, and it just illuminates the sinus cavity there, that maxillary sinus, and I'm just going to check for any fluid or masses in there. Okay? So here we go. This place right here, checking underneath. I don't see any fluid or any masses. Same thing over here. Any fluid, any masses. Alright, very good. Now what I'm going to do is I'm going to move on, and I'm going to check your mouth and your throat out. So what we'll do is I'm going to just do a generalized inspection, okay? And if you can open your mouth for me real wide, I'm going to use the tongue blade. Can you stick out your tongue just a little bit? Alright, perfect. Alright, you have very pretty teeth. Alright. Inside of your buccal mucosas, which are your cheeks. Alright, very good. Very good. Now, one more thing. Can you open your mouth real wide for me? Stick out your tongue and say, "Ah." Alright, very good. Your uvula is centered, alright? And if I was grading your tonsils, do you have any trouble with your tonsils this time? No? Okay. I would grade them probably right at a 1 because they're not very close together back there. Okay. The next thing I'm going to do is I'm going to palpate your tongue, okay? Now I'm just going to check for any lumps or nodules or any lesions on your tongue as well as on the inside of your mouth, okay? Do you have any trouble right now? Do you have any soreness in your mouth? Okay. And get these lovely gloves on. Okay, so if you can open your mouth real wide for me, I'm just going to start here on the inside and feel. I don't see anything there. There's what's called a Wharton's duct down here, and it produces saliva, okay? Now the same thing on this side. Just going to be feeling around, make sure that there's no lesions or if you feel any pain or discomfort. Same thing there. So it produces saliva, that Wharton's duct does. Now, I need you to lift your tongue up, top to the right, and then the Stenton's duct, lean down just a little bit. There we go. Stenton's duct at the bottom of your tongue, okay? And it looks fine, no swelling or anything about it. Alright, now, don't see anything else. Do you have any questions for me? Okay, Brittany. So now what I'm going to do is I'm going to check your tongue, like I said a few minutes ago. I'm going to check it, feel it for any lumps, and look for any white patches on there. So I'm going to put glove up again. Hopefully they'll go on me a little bit easier this time. I'm just going to take a 4x4. You can stick out your tongue for me. Alright. And I'm just going to palpate your tongue. I'm going to turn it to each side. And I'm going to use my pen light here. Make sure I don't see anything again. Alright, very good. Same thing. Just going to palpate your tongue. I don't see any white patches, any lumps, anything like that in your tongue. So very good. So that concludes our assessment of your nose and mouth and throat, and the next thing that we'll move on to is your skin. Okay? Do you have any questions for me? No. All right, thank you.
Go.
Okay, Miss Brittany, now we're going to continue our assessment and start with the skin. Okay, so I'm just going to do an overview of your skin. Do you have any bumps or lesions or anything that are concerning to you today? No? Okay. So I'm just going to start off and I'm going to inspect the skin, all right, and check for any color changes, any hypopigmentation or hyperpigmentation. I don't see anything there. All right, very good. No bumps, no bruises, no lesions that stick out. Look abnormal. Now, do you check your skin on a regular basis? Yes. All right, very good. I'm just going to untie your gown here just a little bit. And check the back. Alright. Very good. Now, I'm going to come back around. And I'm just going to feel in your scalp. Make sure there's no lesions in your scalp. I know I tested this earlier, but very good. Hair is very shiny. Texture is smooth. Good. And no hair loss or anything noted correctly? No. Alright. No lesions on the back of your neck. Alright, very good. Now, I'm going to check for your skin, make sure it's clean, cool, or clean, warm, dry, and intact. And it is. Like I said, I don't see any bruising or anything. Alright, very good. Now, I'm going to teach you your self-examination. You should be doing one at least once a month, okay? You need to stand. Do you have a full-size mirror in your house? So you need to stand completely naked in front of your mirror, and you need to raise your arms up, raise them up. Look for any lesions, anything in color. You can use the ABCD rule. All right, and I'll give you a handout on that today. It's asymmetry, border, color, diameter, and enlargement or elevation of a lesion. So say this one here, and it gets a little bit bigger, it may change in color, something like that. If you had one there, you got a little bitty freckle, that's it. But if that started to change, then you would notify your physician or nurse promptly. Okay? And you can use also like the hard areas for your back or your neck area. If you don't have a family member to check those, that would be the best. But you can also make sure that you turn to the back of the mirror, and you can use a smaller mirror to look at the back of your buttocks and then the lower back of your legs and stuff. And I also recommend that you sit down in a chair and look on the inside of your legs here using that mirror. And again, if you notice anything that has changes, then you should notify your physician or nurse promptly. Okay? So I'm going to check out your nails today too. So I'm just going to check and make sure that you have good capillary refill, no clubbing of the fingers. Alright, very good. Color's good in pink. Any pain or discomfort with that? No? Okay. Alright. Well, that concludes our skin today, and we're going to move on and we're going to check your eyes out next, okay? Any questions? Okay. Okay, Miss Brittany, this is our last part of our assessment today, and we already did the Snellen chart, and you did very well on that, okay? From that, you have 20/20 vision, but we've got just a couple more tests to complete, okay? So we're going to start out, and we're going to do what is called a cover test, okay? So I want you to, I'm just going to put this over your eye. Keep on staring right at my nose, okay? And don't move there. Alright. And I'm just watching to see if your pupil constricts or dilates. Right. Same thing on this side. Alright. Very good. Alright, very good. Now what I'm going to do is the confrontational test, and it tests your visual field, okay? So I want you to go ahead and cover your eye, cover the same eye as mine, alright? And you just tell me when, just say yes. There you go. Just say yes when you see this in your visual field. Alright. Okay, very good. So we're going to do the other side, same thing. We're going to do it here. Without looking, stare at my nose. Okay, very good. Now, we're going to do the 6 cardinal signs of gaze, alright? So, I want you to just follow my pen light, and without moving your head, just follow it with your eyes. Very good. Very good. I'm going to do it the other way. Alright. Perfect. You're doing very well. Now we're going to do the accommodation test. So I want you to stare off into something distant. Alright. And I'm going to put my finger right here. And I want you to bring, and when I say, just look at my finger, okay? Okay? And look it off into a distance. And back again. Perfect. Alright. Now what we're going to do is the corneal light reflex, and I'm just going to turn off the lights for that one, okay? I'm going to check to see. Alright. Alright, and so the light will be shining directly into your eye, okay? I'm just going to watch and make sure. There we go. And it constricts. And the same thing on this side, okay? Just stare straight at me. Okay. Very good. Now, since we have the lights off, I'm going to go ahead and I'm going to kind of view the inside of your eye. Alright, and this is the ocular fundus. So I'm going to shine this light directly into your eye. I'm going to get real close, okay? And I'm going to look into the back of your eye, check for the vessels and red reflex, okay? Alright, so here we go. I can't get in there. Okay, here we go. Let's try this again. Look straight ahead, okay? Alright, and what I'm going to do is I'm going to dial this down to 0. Okay? Alright, and right now I can see in behind your eye and make sure that there's no vessels there, checking your iris. Okay, very good. I'm going to do the other side. Like I said, be real close and personal, okay? Alright, so just stare off straight there. I think I'm going to stand up. Alright, very good. Again behind your eye. Get the vessels out. Alright, everything looks really good, okay? Now, step back there. Turn the lights back on it, and now I'm going to just check on the outside of your eye, your eyelids, your eyebrows, and do a few more of the tests, okay? So I don't see any bruising, lumps, nothing like that. Everything looks good and intact. So now I'm going to check your conjunctivitis. Open your eyes for me. Perfect. I'm going to pull your eyelids down. Just going to check on the inside, make sure they're good and moist, and I don't see any lesions or anything. Now I'm going to check your conjunctivitis. I'm just going to push right here. Make sure we got a tear duct there, okay? Alright, perfect. Alright. Corneas and your pupils. So I'm just going to look at those. Good. Very good. Alright. And I think that completes our test today. Do you have any questions for me? No? Okay, very good.